Cholera, a highly infectious waterborne disease, continues to pose a significant global health threat, particularly in areas with inadequate sanitation and limited access to clean water. Despite being preventable and treatable, cholera outbreaks persist, leading to substantial morbidity, mortality, and social-economic burdens. In this special report, health correspondent Lois Abba Sambo highlights the critical importance of funding for cholera outbreaks, emphasizing the necessity of financial resources to implement comprehensive prevention and response strategies. A report.
A blessing from the heavens, the rains, bringing relief to parched earth, reviving nature's vibrant hues and rejuvenating the spirit. However, amidst the celebrations of this much-needed precipitation, a lurking shadow dampens the happiness, the alarming rise of cholera outbreaks. It lurks in contaminated waters, waiting for an opportunity to strike, and its consequences are dire. Cholera infiltrates the body through the consumption of contaminated water or food, perpetuating its vicious cycle of infection. In the year 2021, the Nigeria Center for Disease Control and Prevention recorded 111,062 cases of cholera, with 3,604 deaths. In the FCT, all 6 area councils were affected as cases of cholera were recorded in 26 wards and 120 communities. Baukpe, located in Kuje Area Council of the FCT, was one of them. A common sight here are buildings without toilets, paving the way for open defecation, dirt littered on the ground, being washed into the nearby stream, which serves as their source of water. With no potable water supply and no toilets, this community is a recipe for a cholera outbreak. In this red heap of sand lies the remains of Ezra Ayuba, who died as a result of the cholera outbreak in 2021. Ezra's mother, Rebecca, recalls with heavy heart her son's ordeal.
He met me in the morning and gave me 1,000 naira for feeding. Later in the day, when it was about to rain, he came and met me and said I should call the doctor. I asked what happened. He said he had diarrhea, but he did not vomit. He did not eat anything apart from the okpa that he bought, which he barely ate. By the time I was able to call the doctor and he was given 4 drips, he told me that his strength has failed. We then took him to Kuje Hospital and they said they could not handle the situation. He was taken to Lupe, but he did not make it.
Cholera remains a major public health threat in Nigeria, transmitted majorly by ingestion of food or drinking water contaminated by the feces of an infected person. Cholera can easily be spread by moving water.
As much as possible, we should try to avoid defecating in the open, because these are the same feces that got washed into our water sources, into the rivers, and then people go to fetch the same water for cooking, for drinking, and for washing fruits. All these fruits you see in them, I see them fetching water. You don't know where the source of their water is from.
Mrs. Gift Benjamin also survived the cholera outbreak, but says her immune system has since been compromised.
In the night, as I just wake up, I feel dull, and I start vomiting, shitting. As I start shitting, wake up, and I tell my husband, say, "May go." There's one man here where they help us, they give us drip, or even the drip. I can feel help you drip. You now go call and come. As he call am, he now come, he now give me drip, and the thing no stop. In that night, we rush to Sambo hospital. As we go there, they give me drip. I almost get 1 day there, but the thing no work. We go to Soka. As we go there, they give me drip up and down, the rush. Thank God, the thing now stop. 2 days, we get 2 days there. We now come back house. See that I know, as in to come back, we come back house, but I no feel well, I no feel normal that time. As in the sickness, I just come back house. That day in the night, na rice I chop. And as I chop am, the thing no digest for my stomach. I vomit it out. But up till now, since that time, I can't be able to do the work like this as permanent work as I used to do. Up till now, I can feel headache or stomach pain.
With limited access to adequate sanitation facilities, Baupe finds itself on the precipice of recurrent cholera outbreaks.
Our chief secretary, I called him and I told him everything, that before you people can be okay in this community, you have to gather yourself. I called up all of them, I spoke to them, I let them know the causes of this thing. I interviewed them about the source of the water, because the water can contribute a lot of things to the disease. And even the where they defecate around the community, I have to tell the community, I enlighten them that the community, we need to sanitize them.
Riding on the response of the COVID-19 pandemic, the FCT was able to set up its Emergency Operations Center with a rapid response team, which came in handy during the cholera outbreak in 2021. Has this been sustained to get ready for future disease outbreaks?
To already have the team on ground, the rapid response team to outbreak, where it's already established at the area council level. So when we got information of any outbreak, we swing into action. So less than 24 hours to respond to any outbreak reported to us.
In the year 2022, Nigeria experienced a devastating flood, killing over 600 and displacing 1 million people. During this period, a major increase of cholera cases was recorded.
We saw it last year with the floods. We're going to see more cases if prevention is not in place. We know that prevention is better than cure. So what we need to know, we need like two main things. One is adequate water and sanitation in place. So as well, we are working with partners and government to try to improve water and sanitation across the country. I have to say, being very honest, there is not a lot of funding for that at this moment. So we're trying to be innovative how we can do that. And the other thing is to have preparedness in place, right? The best outbreak is the one that you don't notice that is happening because you are able to interrupt it as soon as possible. It means to preposition supplies like cholera beds, like IV fluids, like treatment, so we can respond as soon as possible. And this means, again, strengthening the health system.
The floods have soon become a yearly occurrence, and in the year 2023, the Nigerian Meteorological Agency (NIMET) has again predicted floods in some parts of the country, including the FCT.
Flash and other flood will be experienced in other cities, city centers across the country. Among these cities are Lagos, Kaduna, Suleja, Gombe, Yola, Makadi, Abuja, Lafia, Asaba, Port Harcourt, Yenagoa, Ibadan, Abeokuta, Benin City, Birnin Kebbi, Sokoto, Lokoja, Maiduguri, Kano, Osogbo, Ado-Ekiti, Abakaliki, Awka, Nsukka, Calabar, and Owerri, as we learn and recover from the catastrophic effects of the 2022 flood disaster.
With the rains already here, Nigeria is looking at a possible repeat of the year 2022. With these predictions, what is the FCT doing to mitigate the possibilities of a cholera outbreak?
In all these primary healthcare facilities, we have people that we call our surveillance focal persons. So when they see these cases, they report immediately to the DSA knows that it's covering that area council, and he goes in there, check, investigates if it is truly a suspected case of any of the epidemic-prone diseases. They go to investigate, and if it is truly the case, they take samples to the lab, and the National Reference Lab, we're lucky, of the NCDC is in FCT here, and it's of no cost to the patient. The government bears the cost.
Funding for cholera prevention allows for the strengthening of surveillance systems to monitor potential outbreaks and respond swiftly to mitigate their impact.
The budgetary provisions are already there. Our other aspect we are having as a challenge is the budget is under the National Assembly. We are not like a state. Everything has to go to the National Assembly, and the President, Commander-in-Chief, has to assent. So that is an area that could slow down the process.
Government needs to take immediate action by investing substantial funds in epidemic preparedness to safeguard the health and well-being of citizens. Lois, Abba, Sambo, ASO Television News.